I'd like to thank the organizing committee for inviting me for this wonderful conference. And I'd like to say how happy I am because of what congratulating them for all the work that they are doing, especially involving students. I think that is really something remarkable that I'd like to do in Lisbon. So I'm going to speak on dental extraction, Albucasis, and Greek-Roman legacy. Starting with Goethe. The surgeon devotes himself to the most noble of all tasks, to heal without miracles and to work out wonders without words. Dental problems can produce the most excruciating pain and can only be relieved sometimes by tooth extraction. Dental surgery is mentioned in Hippocratic treatises, on pain arising on teeth, it is advised that if the tooth is decayed and loose, remove it. If it is not decayed or loose but produces pain, dry it out by cautery. Medications that are chewed are useful as well. So dental extraction seems to be carried out in the time, and the instruments necessary should be some with which the learner must be proficient, says Hippocrates. The tooth forceps, odontagra, and the uvula forceps anyone can employ, since their use appears to be straightforward. The tooth forceps was first described in the book Mechanics, attributed to Aristotle, as an instrument to help physicians in tooth extraction. It was of iron and was composed of 2 levers on a pivot. A Greek later edition of the work by Henry de Monantail, translated into Latin, presented the drawing of the instrument of a small forceps with the nozzles closing completely and handles bent outwards, allowing better gripping. This is a set of instruments from the Temple of Apollo from Herophilus' time, from the National Museum of Athens, and it is the dental set that came to us. It displays the basic instruments for dental extraction: a small forceps, then you have a knife, and tweezers, and this is a knife, and these are tweezers. This is lateral. The dental forceps resembles the drawing by Monantail. The nozzles do not close completely. They must be broken, otherwise they would not grasp the tooth. According to Blickus, only one surviving type of Greek-Roman forceps is regularly of iron, so this is of iron, also consistent of 2 elements on a pivot, like the item described by Aristotle. Over 20 dental forceps survive. Many were recovered from archaeological contacts. Most are of copper alloy. There is evidence that a tooth forceps could be used in bone surgery as a weapon forceps to extract arrows and other penetrating foreign bodies. The tooth forceps could be multifunctional. The first alert on the dangers of the procedure tooth extraction, of course, came from Herophilus of Chalcedon in his pioneering attempts to disclose the cause of death in post-mortem examinations, listing tooth extraction as a cause of death. Celsus presented the most complete description of the indications, technique, and complications of tooth extraction, such as dislocation and fracture of the jaw. Healthy teeth should be preserved by a wire when broken. When teeth become loose, either from weakness of the roots or disease drying up gums, the cautery should be applied without pressure on the gums, which should be smeared with honey and swirled with honey wine. Tooth extraction is indicated when pain cannot be managed. And here is the text by Celsus that I'm not going to read. And whenever after extraction a root has been left behind, this must be at once removed by the forceps made for the purpose that the Greeks call risagra. Celsus' technique is very correct for the time. He refers to difficulties with small teeth and roots, bent roots, and advising to fill with lead a cavity so that the tooth did not break under the forceps. The instruments referred are a tooth forceps, a small forceps valsella, a scraper he refers indirectly, a probe, and a special forceps for the roots. Celsus did not refer to anesthesia. Caelius Aurelianus is a Roman physician and writer from the 5th century AD, and he says that dental forceps should only be used when the tooth could not be pulled out with the hand. He stated that the lead dental forceps, which could be called dentiducum in Latin, as he referred, and he referred to dental extraction, that it was prominently displayed in the temple of Apollo of Delphi for the purpose of showing that those teeth should be pulled which are ready to come out or are loose and shaky, in short, those requiring for extraction no more than the pull of a lead instrument. But if these physicians hold that every aching tooth which harms sound teeth should be pulled, it follows that whenever there is general pain throughout the teeth, all the teeth should be pulled. This is obviously very incorrect. Now we have pointed out in our medical treatise entitled Answers how decayed or loose teeth should be extracted, but only if they cannot be saved. So this is in contradiction with the previous sentence. Paulus Egineta, the last Byzantine compiler of Greek-Roman medicine, and the most important source for Albucasis, also refer to dental extraction. It should be noted that Arabic authors read and translated Greek medical textbooks into Arabic. They did not read the Latin authors. The sources for Albucasis were Hippocrates, Paul Egineta, who mentioned a tooth extractor, a small tent, especially a respiratory, and a file. And now the dentistry case from the Bustov collection, the National Museum of Archaeology in Lisbon. So it was donated to the museum by this collector, and so the exact dating and provenance is not the provenance is not known, and dating is also difficult, but the instruments are from the 1st century BC until the 3rd century AD. The most important piece is this dental forceps that you see. It is on copper alloy. It's powerful jaws, and this bentward spatula. The other instruments, well, this is a scalpel, and these are tweezers. This is a probe, and these are a spatula, Siato Siscomele, and a box to store medicine. So these instruments are to prepare medicines, and this, and this, and these are for tooth extraction. The instrument resembles this. Resembles these tooth forceps from Vindonesa. So this tooth forceps is only for frontal upper teeth. And so is this. And this is another with some similarities, as you can see. And this is a root forceps. Karl Schulhoff, from which I took the pictures because I think they are good, presented an ensemble of Greek-Roman hooks, tweezers, knives, and cauteries used in dentistry, corresponding to the descriptions by Celsus and Paul Egineta. No instrument resembles the backward bent spatula from Lisbon dentistry case that seems to be a periosteal elevator. I found no parallel for this piece in his work in Schulhoff, neither in later bibliography consulted on this subject. So I think this is a unique instrument. Here it is, the forceps, and this is the collection by Karl Schulhoff of hooks, tweezers, and here knives, and there's a cautery there. There is no cautery in the one from Lisbon, but I think this is really a very important and unique specimen. These two bone pixies are also part of the collection, and they are very interesting because of their lead. As you can see, the lead has the form of a poppy capsule. Oh, doesn't point. Well, you see the capsule there, okay? It was usually, well, there are many of these leads since ancient Egypt and from Crete, Heraclean, from Minoc civilization. So, poppy, Papaver somniferum was used for ritual purposes and for medicinal purposes, for anesthesia, and it was stored in boxes with the lead of the plant. And another, well, this may be, I think it is, it might be Yoshima's Niger, because it is also the drawing. Well, it's also a capsule of a plant used for anesthesia. So I think this is also, these two pieces together with the other spatula are very, very special. Now, Albucasis. Albucasis, deals with dental and root extraction in the chapters 30 and 31 of his book on surgery. In the previous chapter, he recommended that the outer surface of the teeth and molars should be scraped, and also between the gums to discern crusts or gritty substances till nothing remains. He divided a number of scrapers also for the inner side of the teeth. Well, he refers to barber surgeons, and I could not, I must say that barber surgeons are not mentioned in antiquity at all. And he refers to his malpractice, of course. For Greek and Roman doctors, surgery was a noble art performed by physicians. Surgical tools were proudly exhibited by physicians in funerary reliefs. Here you have a whole set of instruments of a surgeon, and here you have a smaller set. This is from the Lateran Museum, depicts a tooth forceps as part of the surgeon's instrumentarium, together with a cupping vessel, a clister syringe, a medicine box, surgical knives, and probes. The medical instrumentarium from a funerary relief from Peloponnesus also depicts a surgical instrument set with two tooth forceps. See here. This set belongs to the Berlin doctor's funerary reliefs that presents a physician that was heroized for his excellence in medicine, just like Asclepius. Now, Albucasis dental instruments describing extraction. Albucasis advises that toothache should be treated with every device, and that the physician should be reluctant to extract because nothing replaces the tooth because it is a novel substance. The physician should only proceed to the extraction if the patient is determined to have it out. And here we have the patient deciding for the surgery, what was interesting. He advises to act with deliberation because the pain often deceives the patient who does not think that a sound tooth is provoking pain, but only the extraction of the rotten tooth will relieve.